Complete all pre-skill patient education, assessment and skill preparation. Verify that the patient's vascular access is patent and functioning properly prior to initiating blood product administration. Ensure patency by checking for adequate blood return and assessing the site for any signs of infiltration or complications. Inspect the site for redness, swelling, bruising, leakage, or signs of infection, and by assessing for any tenderness or discomfort reported by the patient. Monitor the patient for any pain, burning, or discomfort. Obtain blood only when ready to initiate the transfusion. Inspect the integrity of the blood bag. Return if problems are suspected. Start transfusion within 30 minutes of obtaining blood and complete within 4 hours of initiating. Verify blood using the EHR and another qualified healthcare member. Review the following items: order, type of blood, patient's blood type, cross-match test performed, donation number, expiration date, and any special processing. Obtain the blood or blood component administration tubing specific to the product being transfused, and ensure it is connected and positioned correctly, with the roller clamps closed prior to initiating the transfusion. If using a Y-connector blood tubing to administer blood, spike an IV fluid bag of normal sodium. Open the roller clamp and prime the entire length of the administration tubing with normal saline, ensuring that all air is expelled before connecting to the patient's vascular access. Close the roller clamp. Spike the blood component using aseptic technique, taking care to keep the roller clamp closed to prevent unintended flow until ready to begin the transfusion. Connect the blood administration tubing to the IV pump designated for the transfusion, ensuring all connections are secure and the pump settings are prepared according to facility transfusion protocol. Trace the tubing of catheter from the patient to the point of origin. Connect the IV tubing to the patient's IV line. When multiple IV sites or solutions are in use, label the tubing and containers with the route and medication solution near the patient and at the source. Take vital signs before, during, and after infusion. Begin the transfusion at the prescribed initial rate of approximately 1 milliliter per minute for the first 15 minutes. Monitor the patient closely for any signs of a transfusion reaction.
You feel hot? Itchy?
Measure vital signs throughout the transfusion according to policy. If no reaction occurs within the first 15 minutes, increase the infusion rate as specified in order. If a transfusion reaction is suspected, immediately stop the transfusion and notify the provider. Contact the blood bank and return the blood product, following facility protocol for managing transfusion reactions. Provide appropriate support and monitoring for the patient throughout the event. Once transfusion is complete, stop the pump and close the roller clamps. Disconnect the blood administration tubing and flush the IV catheter with normal saline to maintain patency and prevent clotting. To finish the infusion, take post-transfusion vital signs and complete all the necessary documentation.